also, you know, serotonin has this kind of enigmatic role in that it's involved in so much more as a neurotransmitter than just mood. Reproduction, behavior, and I think specific to psychedelics, coping mechanisms, and specifically more like active coping mechanisms. So we have what we think of like as passive or coping mechanisms associated with tolerating our current situation even when it's adverse. And then we have coping mechanisms that help us kind of rise above the situation that we're dealing with and act as sort of a catalyst for change. And I certainly feel that the psychedelic-assisted psychotherapy intervention in its totality, kind of what is it about? It's about catalyzing a change in someone or kind of changing their lifestyle. You know, when it comes to psychedelic research, it's all about the serotonin neurons in the brain, but that's actually really only about 10% of the serotonin that you have in your body. 90% of it is in your gut. And your gut is a much more ancient neural network than your brain is. You know, worms have a gut, they don't really have a centralized nervous system. So I think that, especially given the kind of expanding field of microbiome research, the idea that, you know, what you eat matters, that the gut is talking and in communication with the brain, and the kind of somatic sensations that many people feel with psychedelics, I really think there's a lot to explore as far as how psychedelics are affecting serotonin neurons in our gut. As far as psychedelic experiences, it seems like there's kind of one subtype of serotonin receptor that is very pivotal, and that's the serotonin 2A receptor. We have at least 14 different types of serotonin receptors discovered, but if you block this serotonin 2A receptor and give somebody a psychedelic, they won't have a psychedelic experience. So it really seems that this receptor is central to psychedelic experiences. Not to be so reductionist, because there's plenty of other receptors and things that psychedelics do to us, but at least this receptor seems pretty central to a drug having an effect. These are some different psychedelics by class, and the point here is not necessarily to have you understand what all of these classes are, but more to have an appreciation that not all psychedelics are structurally the same. Some, like the prototype from nature is mescaline, found in the peyote cactus, and also some San Pedro or Trichoceros types of cacti. This probably the most common synthetic one that you hear about is MDMA, and these are phenylethylamines. Phenylethylamine is a shared backbone with amphetamine. So these are more psychedelic / stimulants. So they're stimulating types of psychedelics. Tryptamine psychedelics are probably the kind of classic ones. Things like psilocybin, LSD is your classic synthetic tryptamine, and then DMT or dimethyltryptamine again is the kind of active psychedelic component of the ayahuasca brew. And these ones are serotonin analogs. Serotonin itself is sometimes abbreviated, as you can see in this slide, 5-HT, meaning 5-hydroxytryptamine. So you can think of tryptamine psychedelics as essentially mimicking the structure and action of serotonin. There's a few others out there. Ketamine is actually an approved drug now for treatment-resistant depression. There was a nasal applicator that was approved earlier this year. And then ibogaine, which is a very interesting compound that has seemingly incredible potential for the treatment of substance use disorders or addictive patterns of behavior, but also has some kind of cardiac risks or cardiac toxicities that some of the other psychedelics don't. Again, 2A receptor. Oh, I'm still on this slide. All right, psychedelics and mental illness. So there's a few population level studies out there that have looked at what is psychedelics when just people use them in the population. So this is outside of mental illness, this is outside of a structured protocol, and what they found is that the persons that report histories of psychedelic use actually have a lower chance of being diagnosed with a mental illness. And, you know, is this a causative relationship? We're not really sure. You know, perhaps there's other factors in people's lives that, you know, they're seeking psychedelics because things are already going very well for them, So you can't say that they have a protective effect, but it's certainly very reassuring to see a population-level study of essentially recreational use and not finding a signal for increased mental illness. Psychedelics, especially the tryptamine and phenylethylamine psychedelics, the serotonergic ones, are known to exacerbate schizophrenia or bipolar illnesses, so these would be considered contraindications, and there is no active research going on with at least the serotonin-based psychedelics and bipolar illness or schizophrenia right now. I'm not going to talk about ketamine tonight, but ketamine is able to treat depression associated with bipolar disorder. So, you know, if your client has bipolar disorder, and especially a bipolar disorder where depression predominates, and you know, they're curious about some type of assisted psychotherapy, probably ketamine would be the go-to at this point in time. Psychedelic-assisted psychotherapy we'll see is being studied for things like depression, anxiety, especially anxiety associated with a life-threatening illness, so kind of like existential anxiety, as well as trauma disorders like PTSD and substance use disorders. I think it's very interesting because this field of research is really advancing quite quickly, and all of these disorders, except for maybe substance use disorders, right now the first-line therapies are antidepressants, which tend to interfere with psychedelic experiences. So me as a pharmacist kind of thinking, you know, 5-10 years down the line maybe, if some of these psychedelics gets approved, then there's going to have to be some type of process for safely tapering and discontinuing existing medications in order to kind of prepare them to have a beneficial psychedelic-assisted psychotherapy experience. So how might psychedelics improve mental health? Well, when a psychedelic activates the serotonin 2A receptor, there's a bunch of different things that happen. There's changes to gene expression, and there's changes to this area of the brain called the default mode network. The default mode network is this functionally interconnected set of neural network that is thought to be self-referential. So it's active when we're at rest, and it's involved in self-referential activity. So this is kind of neuroscience's correlate to psychology's ego, in that it's your construction of your sense of self, construction of your sense of identity. And it seems that many psychedelics, psilocybin, ayahuasca, or DMT, as well as LSD, have been shown to decrease default mode network activity, and when they do this, it's associated with an ego dissolution, or a lowered kind of sense of self, and the kind of long-term changes are associated with improvements in mindfulness and psychosocial functioning. So the default mode network is quite hot right now in the neuroscience world with psychedelics. Psychedelics have recently been called psychoplastogens, meaning that they're able to induce neuroplasticity. And for the longest time, we thought that once you have your adult brain, the number of neurons, it just gets less with age. And the brain doesn't really have the ability to regenerate itself. And you know, perhaps it has a limited capacity. You know, we're searching for things that could be helpful for traumatic brain injuries or strokes where there have been kind of massive insults to the brain. But it does seem that these psychedelic compounds are